Hello, everyone.
Hello, doctor.
Yeah, hi. Okay, so all of you are ready to roll? Good evening to you all. Okay, right. So, today we are going to have an introductory session on MRCOG Part 2, and I bet that all of you are excited to start this journey, right? Or maybe some of you are looking for guidance as to how difficult part 2 is going to be. Accordingly, maybe you are going to decide on taking the exam this time, maybe not taking the exam this time. Somebody are in dilemma, somebody are quite convinced that they will appear this time, right? So, what do you think? What is the most important key in passing this exam? Any of you, either in the chat box or by unmuting yourself, you can join in. I can see 73 candidates joined in. So at least let's interact so that we don't have a boring session.
Hi, ma'am.
Yeah. So, okay, so yeah, people are talking about mental preparation, more time given to most important topic like labor, consistency. Right. So yeah, you have got the mute point. Am I not clear? Right, right. So it's about consistency to proceed in the path, most importantly, to proceed in the correct path. Of course, the syllabus is going to be extensive. It's not about studying hard. It's more about studying smart, right? So, yes, so it is a continuous process and it's a consistent effort. So with that, let me tell you, you may not have to be the most talented or the most intelligent person in order to have success in life. But one thing which you cannot compromise on is consistency. If you're having effort consistently, if you're putting in effort consistently, repeatedly, religiously, day in, day out, then success has to, of course, follow. And of course, we definitely need to have you guided in the correct path. And for that, we have our LMS learning management system. That is an app-based or a website portal-based management system where there is a site. We will be taking you on a tour of that shortly after. But just to give you an overview, this is a learning management system, sort of like a website, which has got all your key important preparation materials under one system, right? So what it is going to help you with easy revision, with segregating your topics, which will help you be organized. Because many times candidates ask me, how long of an effort does it take for a person to pass MRCOG? How much of a preparation? See, everyone's scenario is different, right? But I would say a candidate who's putting in effort for 6 months has a very good chance of passing MRCOG. And the 6 months of concerted effort would result in at least 3 revisions of your course, of the most important parts, of the most highlighted topics, and you all need to have it one particular place so that things are organized. So your LMS learning management system is going to organize all of that. We will be briefing you about the system later on in this program. And we also have a Telegram group. Now, why do we need a Telegram group? So that you all feel connected, right? So that when you're feeling bored, and you're finding that your study buddy is there and they are posting questions, maybe you feel charged up that yes, despite all the difficulties, all the challenges, the family commitments, the work commitments, if so and so person can join and put in their efforts, so do I, right? So that sort of connectivity, that community feeling will exist in the Telegram group, where we will be daily sharing questions. There would be group moderators who will be posting questions, solving your queries, and you will always be in touch with each other over the learning process. Now, the mentors for this course, the batch of January 2026, we have Dr. Muhammad Hassan. He has been an excellent mentor for so many long years. Same for Dr. Shazia Maqsood. And we have our course moderators, Dr. Rupam Jain and Dr. Shiba Hussain. Both of them are brilliant, and they are going to solve your day-to-day queries and tackle everything very smoothly, guide you on a daily basis. And they're going to note if you are, following, if you are lagging behind, and accordingly, we will be taking up in our live sessions and courses. Of course, we will be there in your Telegram group as well. We will be there asking you questions, solving your queries at times. And this combination of mentors and moderators is your key to success when you take this course, as has been proven time and again. In our last January 2025, the top scorer was Dr. Deepthi with a 78% of score, followed by Dr. Mariam Arslan, Dr. Rabiatul, Dr. Rahila, and Dr. Sadia. And I distinctly remember Dr. Rahila, who was always, in two minds whether I should sit for the exam. I've got so many commitments. Maybe I can, maybe it will be difficult. But she stuck to her consistent efforts, and see how she had shown during the exams. So many of you have already taken the exam once before. Many of you are maybe getting exposed to the idea for the first time. So let me spell it out for you. There will be two papers. Paper 1, which will contain 50 SBA and 50 EMQs. That will be a total of 3 hours, followed by a lunch break. The lunch break would consist of 1 hour, right? And after that, there will be paper 2. Paper 2 again will be the same structure of 50 SBA followed by 50 EMQs for 3 hours, right? So as I see more and more candidates joining in, can we have somebody to be more actively involved? Do we have candidates who have taken the exam before? Okay, so most of you are all fresh candidates. Okay, voice not clear. If there is an echo issue, maybe you're locked in with 2 devices. Right, so if you're all fresh candidates, so paper 1 would be 3 hours, paper 2 would be 3 hours, and at a stretch, it will be a 7-hour scenario. So it's not just about reading, it's about practicing and applying whatever you have read, right? So it's not just about mugging up the syllabus. It's about applying the guidelines, applying the knowledge that you have acquired to solve the questions. And most importantly, the crux of the exam is the point where you have to sit through 7 hours in front of a computer and deliver your very best, right? So that sort of tenacity building is extremely important for you all. And we will be giving you ample practice on that. I know there would be candidates who would prefer a hard copy sort of material for reading. I know there are. Aren't you all? I mean, all of you are very tech savvy, or some of you are there who would prefer the old school way of pen and paper. Yes, yes, yes. Dr. Nazia is agreeing. Old school, okay. But see, why we make it so much of app-based and interactive online, that is because you have to, at certain point of time, sit through an exam 7 hours in a stretch, looking at a computer screen. Okay. So there are two aspects to it. First of all, being consistent in your efforts, being focused that much, and having that tenacity. You know, it's like running a marathon. Solving 100 questions in a go is like running a marathon, and you have to positively condition yourself to that. You cannot run a marathon, a 10-kilometer marathon in one single day, right? You have to build your stamina for that. So for this thing, we will have mock exams. There will be module-wise mocks. There will be a grand mock at the end in our portal where you will appear and you'll judge yourself how much of a tenacity you're having in solving questions at a go. So that the amount of dedication and effort that you've put in your question number 1, the same amount of dedication and effort you can put in at question number 100. The same focus remains throughout the exam. So that tenacity building is important. No matter you're old school or no matter you're a new school, but you have to have this habit of solving the questions online, okay? Because that is how the exam is going to be. It's not a pen and paper exam. It has to be in front of a computer screen. So yes, the live sessions is going to build your tenacity that way. Now, we know about SBA, we know about EMQs, right? Let's look at how RCOG is going to score us. So about the scoring weightage, the SBA is going to be about 40% of the total score. EMQ is going to be 60% of the total score, right? So of course, understandably, you realize what is more important in your life, don't you? Right? So EMQs are of course more important. At the same time, EMQs are, you find a bit more difficult. Are there candidates who are already trying to solve some questions, looking at, practice books and getting a hang of what EMQs are? Any of you can join in the chat box, join in by unmuting and share your experience. No? Okay, so we have Dr. Maniz saying that EMQ is a bit difficult. Dr. Nazia, yes, I couldn't understand the EMQ. Yes, of course, we will be explaining about EMQs and SBAs. So moving on, let's just start with the easy part of it. So first would be SBAs. And in my exam going strategy, when I appeared for the exam, my strategy was to solve the SBAs first. Why? Because in SBA, there will be a single question followed by 5 options, A, B, C, D, and E. Now they're looking for the single best answer, right? Single best answer. So 1 question and 5 options. And maybe by looking at the question, you're already thinking of an answer. And you're looking at option number A, and hey, you have your answer right there. So you think, yes, this is the answer and I should be marking A. But our advice, the pro tip over here would be go through B, C, D, and E and see if any other option suits better, right? So that is one tip for SBA. Once you're into the curriculum, today is July, the 12th of July, and the exam is 15th of January. So it's a long stretch. You will be slowly evolving, gathering concepts, solving questions, day-to-day practice with Dr. Rupam and Dr. Shiba is going to hone your skills that way. And you will be realizing that, yes, at some point, when I look at an SBA, I can solve it, like a spinal reflex. I look at the question and I know the answer. Okay? So that is the reason I would suggest that in the exam, solve the SBAs first so that your mind remains cool and 50 questions are done. That was my strategy. You may have other strategies. That's fine if you're solving EMQs first, but that was my approach to exam. So first for an SBA, you will read the question stem carefully and you'll identify the key clinical clues. When you'll be doing sessions with me, you will understand that I will be providing you with keywords. Okay, the keywords in a question is what basically takes you to the answer. Okay, so there will be certain points, certain words which are most important for you to identify what they are out to answer. Okay, if you can identify the correct answer, well, brilliant, right? But what would I say? Still go through rest of the options. That is mandatory. And when I practice questions with you, I see that despite how many times I'm telling that, you do keep missing out, that I have looked at option B and that is fine, and I haven't seen C, D, and E. Okay. So, okay. So Amina has a question. Is SBA and EMQs have separately shown by headings? Yeah. So what happens generally, the paper starts with SBAs and then the EMQs are there, but they are all in a series. Like if SBAs are there, it will be 50 in a row, and then there will be 50 EMQs in a row. Okay. So my approach was always to start with SBA because it's easier, you gain confidence, you feel that you have some grip over the exam, and then move on to the difficult part. Now, it so may happen that you have gotten a question which, a topic you're not sure about, you cannot make head or tail out of it, your knowledge is not that much up to the mark. Okay, so what do my students do in such a situation? See, in MRCOG, there is no negative marking. Okay, as of now. So far, the exam module do not have a negative marking. So my suggestion would be, please don't leave a question blank. Okay, no point of leaving a question blank. So how do we try to solve a question if we don't have a sound knowledge of what the answer might be? So my pro tip over here would be try and eliminate the clearly incorrect options first. Okay. And you will always watch out for these absolute terms. What are these absolute terms? Like if a question mentions that this is happening always, or such and such complication is never happening. So if something is mentioned in such absolute words like always and never, in all possibility, that is a wrong answer. Okay. So in this way, you can narrow your search, you can narrow out the options, you can eliminate some of the options when you do not know the head or tail about it. Okay. About EMQs, yes, I'm seeing that in the chat box, many of you have many questions about how to tackle the EMQs. And let me assure you, practice, consistent practice is going to make you all perfect masters in solving EMQs. So, first of all, you have to read the question stem and you have to think of an answer. There will be multiple choices and options and scenarios given. EMQ will consist, say, A to N option or A to M option, right? So about 11, 12 options will be given. And following that, there will be one question at the end of your screen. So A, B, C, D, E, F, G, H, like that up to M options are given. And then there will be one question at the end of your screen. So you first go to the question, read the question, think of an answer in your mind. Okay. So then the next step is you try to find out the answer from the steps. Even if when you have thinking of an answer and you have got the option at, say, suppose option F, still, what would be my pro tip? You all know that you'll have to screen the rest of the options before answering. Okay. Okay, so Dr. Nazia is asking always and never term in the MCQ options. Yes, not the question 10. If they're giving, identify the true statement of the following scenario. Okay, and they're giving something like this complication never occurs in the case. So that will be probably not the right answer. Don't go for the absolute terms. They may not be the correct option. Okay, always never. Do you get this concept clear? Right. So EMQs are also about selecting one answer. Yes, Nazia. So in EMQs also you have to select one answer. In SBAs also you have to select one answer. So, okay. So can I give you an example of SBA or an EMQ? Okay, so about an EMQ. So let's see, I don't have anything prepped up that way. But when we go into the course, when we are taking up the books, we will be solving them together, right? So, okay, Amina says that, yes, I did get the difference between SBA and EMQ. Somebody was asking about the books. Yes, there is a book called Get Through. There is a book on Kalaibani, which has a lot of EMQs in them. And of course, we will be providing them in the course material as well. Okay, so the basic thing is about understanding the concept of it, understanding the logic behind it. Yes, of course, I'll be guiding about the books. That is all there in the system that will all be put in the Telegram group on the same. But don't start your preparation by going through the books. That is what we are going to guide you today in today's class. It is all there in the Telegram group, dear. Don't worry. Okay. So, what about the time allocation? When you go to a particular question, there will be a total of 3 hours, that is 180 minutes. Okay, so one particular candidate have a question that if we have joined the course, we don't need to buy practice books. No, we will be providing you ebooks. So just don't invest your money in buying books. Okay, if you need to, if you feel the need that you have to have a hard copy, you can start by taking out a printout maybe. Okay, Dr. Khadeja is telling that I have started preparation from the books and it's very confusing. Yes. So I remember when I started out, I first went up to a shop and shopped for one of the MRCOG Part 2 books. And there were only questions. And when I looked at the question, it was an SBA. I could not choose the correct answer. Well, I felt, okay, maybe I don't know the concept. So let me just look at the explanation behind. So I looked at the explanation. Okay, fine. Then I went on to the next question, the third, the fourth, the fifth, and I ended up realizing that I am not sure of most of the answers or I'm getting the answers wrong. And whatever explanation is given, I'm not sure about it. So I asked one of my seniors, how do you go about preparing for MRCOG-2? And then she told me that you have to first go through the Green Top guidelines. Okay. So I took up a guideline. I started reading. And of course, I felt bored because it was a big guideline. And I felt like, okay, that is fine. But then how do I apply it to questions? So most often what happens is that you are having a series of GTGs which you're studying. Okay. And you're having books which are having questions module wise. What is the importance of courses is that they are going to give you one particular session in which they are going to give you the gist of the guidelines and also some practice questions. There will be daily schedules where there will be, you'll be allocated that today you have to study this particular guideline. Okay. And you all have studied that particular guideline. And then in the discussion group on Telegram, you'll have question solving, maybe 5 questions, 10 questions from that particular guideline, so that you can apply the knowledge that you have gathered. And that is important. Okay. So I would suggest that don't start preparing from the books. Start preparing by reading the guidelines and then, applying that knowledge by solving the questions. Okay. So is there any need to read the books along with the guidelines? What I'm going to suggest, see, that's a very valid question, Mamuna. See, what you have to understand that so far, our idea of gathering concepts and passing exams were based on whatever curriculum we are following in our respective countries, right? Now, here we are writing an exam, which is the Royal College exam. For that, you have to have a clear concept as to how Royal College is operating. Now, England, UK, they are operating through NHS. Okay, so NHS is their government medical care facility. And the college is providing clear-cut guidelines that if so-and-so patient has come, this will be your first-line investigation. This will be your first-line treatment of choice. Okay, say for example, if there is a patient of heavy menstrual bleeding, the college will say you will do a CBC. You would not do a thyroid function test unless she has features suggesting of hypothyroidism or hyperthyroidism. Okay, so if none of the other features match, just on the basis of having a heavy menstrual period, you're not going to do a CBC along with a TSH. So in our respective countries, maybe we take it on our free will that, okay, we will prescribe so-and-so investigations and write so-and-so medications. We are all practicing differently, right? Somebody may be starting with progesterone for heavy menstrual bleeding. Maybe one of you is starting with tranexamic acid for heavy menstrual bleeding, right? So in UK, each and every one in the NHS system is going to have the same approach to investigations because that is what guidelines are going to define. Okay, each and every management protocol will also be same between Dr. A and Dr. B. So whatever is given there in the guideline has to be followed verbatim, okay, word to word. And that is why you do not follow any other book like Shaw's or whatever books you have followed so far for your post-graduation training. You have to stick to the guidelines because you're appearing for the Royal College exam, you're appearing for the UK exam, so you are basically getting trained to how NHS is operating. Okay? Yes. Dr. Khadeja has a question that someone guided me. The books are of old guidelines. Yes, that is of course true. Books are not frequently getting, updated or having new editions. So whatever we are going to provide you online are going to be the updated versions. And even then, they might fall short of whatever update has been further there. Okay, so it is very much true. So we will guide you on that. We will be posting questions in that way so that your knowledge doesn't get confused. Often it so happens that maybe an old percentage was relevant some time back, and you are solving that particular percentage and you're going back and finding something else in the book because it was an old update. Okay, so somebody else has a query that I'm not in gynae residency. So is there a chance of passing the exam in 5 or 6 months? Yes, of course. I mean, don't worry about it. We will break it down to the basics. You will have to, basically what I'm trying to tell you, whatever knowledge you've gathered so far, whatever work experience you have so far, maybe somebody is practicing infertility, okay? Maybe in your setup, you have a particular protocol when to go for IUI, when to go for IVF, right? But in order to get your answer correct, you have to follow what is written in NICE guideline. So it's all about starting afresh, and it's all about following whatever is there in the guideline. Okay, so we would suggest that you start by reading the guidelines, solving questions with us. We will be guiding you on the books as well. And that is how you're going to crack the exam. Don't go for the books first because you will end up getting confused. You will feel burdened and naturally you will feel like giving up. Okay. So 70 minutes, the first 70 minutes, you will be going for SBA section. Then the next 110 minutes for EMQ section, though these are 50 and 50, but 70 minutes for SBA, because by the time you've practiced 6 months with us, it will be, the SBAs will be at your spinal level. Okay. Okay, so Dr. Nazia has a question. Dr. Mitra, do you think it is time is going to be a challenge during part 2? Because in part 1, time was not that much of an issue. See, slightly a bigger issue than it was in part 1, but still I would say that if you follow this dictum, and I personally never felt that time was an issue in part 2 as well, you might, if you are not consistent in your practicing of questions. Okay, so what we allocate one SBA to 1.4 minutes, okay, and one EMQ scenario. One particular question is 2.2 minutes, okay? Okay, so regarding prioritizing your answer. So first and foremost, if the same data is given in GTG and NICE and also in a talk, what is your prioritization? You will choose GTG over and above everything else for anything considered with RCOG. Okay, so GTG is your gold standard, right? If an information is there, A is written in GTG, B is written in NICE, and C in TOG, so you will go with GTG. Okay. Then comes the prioritization of NICE guideline. Then there will be TOG, right? Yes. So Dr. Khadija is telling that her friend is a part of MedExamExpert. She told this time the exam is so unexpected and difficult. So yes, exam might be difficult because often candidates fixate on particular thing. That is the recall questions, like whatever questions have come in the previous exams. Now, let me tell you, RCOG has a very strict policy about not disclosing their questions. When you fill up the form, you will also be given out a disclaimer, which you have to sign, that I'm not going to, talk about these questions or reveal these questions anywhere. Okay. That is why whatever is the actual questions which have come in the exam, you would never know. But of course, through discussions in groups and how, candidates discuss amongst themselves, slowly a pool gets generated as to what sort of questions have come. What most commonly happens is that even if they remember the question, they may not remember the options correctly, or maybe they are missing out one of the keywords. Okay, and the keywords are very important. Maybe they're missing out the keyword when they're remembering the question. Maybe they're missing out on one of the options. And that is how, just by mugging up the recalls, as we call them, that is the questions which have come before, we call them the recalls. And just by mugging up the recalls, people land up in trouble. But there is this thing, students, candidates, they're oddly fixated about recalls, that I have to solve recalls. Yes, recall solving is important to give you an idea about what particular topics are there. Of course, we will highlight in the classes as well what are the most common areas, what are the most common type of questions that has come from that particular topic, right? But when do you find an exam very difficult? If you have only solved books, if you have only done recalls, and you have not gone through the guideline. Okay. So, of course, the questions won't be 100% from the recalls. The recalls will be at best 10%. And it's very difficult to convince candidates. We know that, okay, recalls are important, but your concept building is more important, because you cannot ever trust the recalls. Okay. Paper to paper, the recalls will vary. Recalls may come as only 10% as it happened this time in July. Okay, so don't depend on books blindly. Don't depend on the recalls blindly. So what you're going to depend on is your own concept, and what you're going to practice is applying that concept to question solving. And we are going to give you ample practice on that. Okay, so moving on, this is like the nutshell of what all modules will be there. Okay, so general clinical skills is not that that much of a separate module. Teaching and clinical governance is an important part of the module, which I'll be taking. That's an important part. It will talk about audit. It will talk about teaching methods. That is something like a very new concept to most of the candidates if you're not already in UK. So if you go through the class, that will be enough. Okay, we don't have a lot of guidelines on them, like not the green top guidelines. We don't have a lot on them. We do have some, clinical governance material, and I'll be shortlisting them and providing them in the class. We'll also be solving questions so that this module becomes easy. Okay. Core surgical skills and post-operative care will be combined together in a class. Antenatal care is important and will be dealt with in separately. Maternal medicine is again a huge syllabus. I'll be dividing that in 3 classes because it's that huge, and I'll try to cover as much of maternal medicine as possible. Okay. Now, management of labor and delivery. Over here, I would like to, tell you this repeatedly. Both of these modules combined together does not have a lot of reading material. You have to go through nice guideline on intrapartum care. Okay. It's a big guideline, but if you have the concepts clear from your nice guideline, and if you apply the concepts, things will be extremely easy. And in order to make your life easy, we are going to provide on this particular session, which will actually make it easy for you to solve the question. If you don't have your on labor and delivery, then of course you will find difficulty in solving the questions. Okay. Postpartum problems is a small module generally combined with these two. Gynecological problems, yes, there will be some guidelines from GTG. Most guidelines will be from NICE. Subfertility, once again, most guidelines from NICE. The NICE subfertility guideline is a power bank of all sorts of questions. You will also have TOG articles on these. Okay. Then sexual and reproductive health, you will be having the FSRH guidelines. Okay. There will be quite a few FSRH guidelines on this. We will solve questions on this. We will go through the guidelines, and for sexual and reproductive health, we will follow the FSRH guideline. Okay. Early pregnancy care, a very concise topic dealing with a very few things, and it will be an easy topic. Don't worry. Can we take a printout of course material? Okay, so don't worry. This, of course, you can and have it pinned up on your study table in front of you in a study board. But don't worry, we will be guiding you in session by session. We have sessions designed on all of these individually. Okay. So we will be taking up EMQ integration theme in a separate workshop where Dr. Hassan will be giving you guidance on how to solve the EMQs correctly, right? So now, what all to study? You know about GTG. These are the guidelines. The NICE, that is also a guideline which I say is the next in priority. Next is TOG. Now, what is TOG? The obstetrician and the gynecologist. That is one particular journal. Okay. So basically, TOG is a journal which is coming out 4 times a year, right? I'll be giving you on suggestions on how many questions you can expect from TOG, how much weightage of your preparation do you need to give on TOG. MIB-brace, we'll be making short notes on it, okay? And that is like a really small, concise thing from which questions will be asked. Just 1 or 2 questions might come, and it's a really relatively small topic to cover. BSG is their gynae oncology guidelines, okay? Then there will be the FSRH guideline, which I have talked about, NHSCP, which is the Cervical Cancer Screening Protocol, SIP, that is the scientific impact paper. Don't worry, just, 2 to 3 scientific impact papers on which questions are asked, and we'll them in our BASH guidelines are important for reproductive health, like all those STD related questions, sexually transmitted related, disease related questions will be from your BASH guidelines. We will give you guidance on that as well. Consent. Consent is important. You don't have to read that much separately just by question solving. You can easily master this thing. So having discussed so far, what did you understand? What should you start with? What should you start reading with? Let me see the chat box a little. Let me see students unmuting and telling me what of all these options would you choose to start reading first? So I have 1 correct answer in the chat box. What about the rest of you? Okay, so 2 correct answer. Yeah, so the most important thing is to read the GTGs. That is the Green Top Guidelines. Okay. So 60% to 70% of the questions in the exam is actually going to be from the Green Top Guidelines, right? If you just log into the MRCOG website, Green Top Guidelines are accessible for everybody. A list will be provided to you once your Telegram group is active. Don't worry, we will guide you on that as well. So don't worry on that. Okay. So total of 60. How many GTGs do we have to study, ma'am? Roughly around 60 GTGs. Okay. Now, the next words are important. You have to memorize. You have to commit to memory all the 60 GTGs. But do I have to read an entire 40-page GTG? No, that is where the difference between studying hard and studying smart comes in. Okay. You will learn the recommendations by heart. Okay, you will start with learning the recommendations that is written in bold in the GTGs by heart. So does the questions only come from the bold part? The answer is no. There are few questions which might come from the explanation part of those recommendations as well. And that is the basic utility of course, where we are going to highlight you what all have actually come in the exam, what all are frequently getting asked. So we will guide you on the same. Now, I know tonight, right after this, you will be asking, give us all the GTG, share all the nice. It will be overwhelming. Okay. We will take up module by module. Right? If we give you 60 GTGs and okay, read these 60 GTGs at a stretch, you will get frustrated, you will feel fatigued, and finally you will feel like giving up, and you will think that, okay, it's too much of a stress. Let's not appear for January exam. We will try next July. So we don't want to burden you with all of the information right now. We will take up module by module in a systematic way. Okay. So this much said and done about the GTGs. Now you might ask, how do I remember all of that you're telling? So once again, we come back to our key motto for today. Being consistent is the key to success. Now, what do I mean by that? When you're looking at a GTG, okay? Suppose Monday morning, you're waking up, okay? Monday morning, you wake up, you take up a GTG, you look first at your schedule for the day, what we are providing you as to cover, what you need to cover for the day. Dr. Rupam is going to beautifully guide you on that if you're a part of the regular course. So you take up the topic, you go through the GTG, Okay. First would be to understand, to imbibe the information. After you've read through the entire thing, if you have taken a printout, you've used a highlighter, maybe you've scribbled a little, important take-home messages here and there. Then, after you've given a thorough reading to the entire GTG, go back and look at it and go through it once more. Okay, that is kind of, like sealing the deal. It is going to ensure that, okay, everything, you have kind of mastered the concepts. What happens is that, suppose today, Monday morning, you have covered one particular GTG. Then the next day, the next topic comes. Wednesday, you have a party to attend. Thursday is maybe your on-call day. So basically, what happened is that Wednesday, Thursday topic you have not covered. Monday topic never came back to your revision schedule. And finally, 2 weeks before the exam, you again open the GTG, the same GTG, okay? And then, of course, you will feel at a loss. You will feel like, okay, all of it is new information. So part 2 is so difficult. No, we cannot make it this time. So no, don't think about it. Okay. So what we were going to suggest you to do, Monday morning, you've read the GTG. After you've read it completely, you have gone through and, recalled whatever is the most important points, the gist of the GTG. Again, either Monday night or Tuesday morning, you go back and have a reading through the gist of the GTG. This gist you may have highlighted on your iPad, you may have highlighted with a marker on the printout, you may have written handwritten notes. Doesn't bother, whatever you're most comfortable with, because everybody has their own unique style of reading, right? So cover like that. Again, go through it at night or maybe the next day morning. Okay? Before you start reading the next day's schedule, just go back and revise what you have read the night before. And Sunday or whatever is your holiday for the week, when you have less of your job pressure or your family pressure, what you're going to do, you're going to take up the GTG you have studied this week, whatever GTG, NICE, talk, whatever topic they have studied this week, and you're going to quickly have a look through all of them in succession. Okay. So yeah, I have a query. So you're asking me, so see, if you've appeared for part 1, you feel like you're not confident with your gynae skills, doesn't matter. You start preparing for part 2, okay? You take it simultaneously. You don't need to wait till you have some experience there. You just start preparing, because just by preparing also you're going to gather experience, right? And of course, you have appeared in part 1, you've given your full efforts. Let's hope that you'll be clearing this time and you'll be appearing in part 2. If you wait for the results, what is going to happen is you're losing precious days, and then part 2 is coming closer. And part 1 is easy to clear. Part 2 requires consistent effort. Okay? So, what I told you, read, recall, and revise. Monday, what you're reading in the morning, Monday night or Tuesday evening, you again go back and read through this. And then again in Sunday is your revision day, or your holiday day is your revision day, when you go through a quick recall of all of that you have read this week. That is how you take the study progressing, because you cannot let the memory of new materials wipe out the memory of the old materials. When is part 2? Part 2 is on 15th of January. So it's quite far away if you look at it like that. But slowly and consistently, like running a marathon, you have to take things up from today itself. Now, the 60 GTGs I have not provided you because it will be too much of an overkill. I'm giving you the NICE guidelines because it's a relatively shorter list. These are the important NICE guidelines. Out of the 22 guidelines, I've shortlisted the 11 guidelines. Doesn't mean that I'm suggesting that you go through reading them right now. We will be taking them topic by topic up while we go through the mini schedule. Okay, so all the plans are set. You just have to be consistent with it. Okay, so FIGO guideline is the international organization. FIGO guidelines are important for gynae onco. That we will provide you only for gynae onco, and that is what is only relevant for RCOG exam, because RCOG is going to follow their own protocol, right? So no use of going through the ACOG, that is American College Guidelines, or through the international guidelines, except where it is relevant. And where exactly it is relevant, that guidance actually comes from courses. So we will take you through that. The FIGO guidelines need to be covered only for the gynecological oncology cancers. Okay. Okay, so when will be the summaries updated? Yes, we are working on it. We are going through it module by module, and we'll be updating that soon. By the time the session starts, most of them that would be updated. Okay. So what about TOG? TOG, I have told you that each year the TOG has 4 volumes. Okay. Okay, so Nazia has a question of the 16 modules. What are the high yield modules? Okay, what I can suggest is that let's have a discussion about all that we have to discuss. Then there will be a question answer session where you'll be free to ask all the questions, and I'll take you to the, solving what all questions you have for me. So about the TOGs, TOG every year will have TOG 4 volumes, like 4 times a year, TOGs are getting published. You have to cover mandatory the last 3-year TOGs. TOGs would be about 10% of the exam questions. EMQs are not going to come from TOGs. You can get SBS from TOGs, okay? The only EMQ I have seen coming from TOG is from the TOG on this one, headache in pregnancy. I'll be covering that in maternal medicine. Don't, lose your cool over it. We will be covering that, don't worry. So covering the last 3-year TOGs and the important TOGs. So this is the list of your important TOGs. These are the timeless, the evergreen TOGs which will never get old. Why? Because these are all important topics. Okay? So these are all the important topics that you have to cover, because they are important otherwise and are not covered by GTG or the NICE guidelines. So somebody was asking, first GTG, yes, absolutely, Nazia. First GTG, then NICE, then TOG. Amina, is it clear to you now? GTG and TOG? No, also GTG, NICE, and then TOG. Okay, so BASH guideline, like I said, it will be discussed in the sexual and reproductive health. It's not, of utmost important, but yes, questions do come. So 60% would be GTG questions, 20% would be NICE questions, the rest 10% would be a combination of the rest of it. Okay, and that varies from year to year, but we will take you through all of that. So this is a rough schedule of what we have. We will again post the actual schedule. There will be certain date changes. So just to have some idea, I'm posting you, these are the live session schedules. Module by module, we are going to take up. Again, there will be final edits. This is not the final list, let me tell you that. So suppose, just for example, say for example, my first session with you is on 6th of September, starting with maternal medicine. Okay. Then again, 13th of September, I will be having maternal medicine with you, and in between, okay, between 6th to 13th, even before the 6th class is there, between 29th to 6th, you'll be covering day-to-day all the topics concerned with maternal medicine in our mini schedule. And that will be taken care of by Dr. Rupam. So every day she'll be posting what all you need to study for the day. This is something like a mini schedule. Again, this is for your just a sample for your understanding. Don't take screenshots of this. We will be again publishing the actual list later. Just for example, suppose in the final rundown, you have class with me on over here on this particular day, say for example 23rd July, say for example. So 15th you're covering headache, then this, then pancreatitis. So you are going list by list on the TOGs, on the GTGs, on the NICE, and then you're coming for the live session. May not be whatever GTGs you have covered on that particular day is coming in that particular live session, but it will be related to the module you are working on. So, for example, I have my class on clinical, say for example, early pregnancy complications in mid of October. So from the first week to mid of October, you'll be discussing in day to day in your Telegram group on the various guidelines on this pregnancy complication module. And daily, you will be reading the material and you'll be solving questions. Okay. Then at the end of it, we will be having a class and a discussion where, I'll be giving you the concepts. Whatever you have had difficulty to follow will be made easy, will be solving questions, and module will be settled. After that, you go back to your LMS portal and you take the mock for this particular module. You can solve the mock as many times as you want. Okay. Say, for example, 18th of October, my class had been there with you. 19th, you have revised some of the early pregnancy complication topics. 20th, you're appearing for the mock and you scored, say, for example, 70% right. Okay. So again, later, when you're taking infections in pregnancy module, again, you start revising early pregnancy at that point of time. Okay. So then again, you retake the mock and see if you can score better this time. So like this, you have to seal the information in your mind. Okay. GTG की percentage कितनी है? GTG is about 60 to 70%. Okay. Most of the questions will come from GTG. So give it the most of your attention to GTG and then NICE. And then, of course, the TOGs, because certain topics are not there in the NICE, not there in the GTGs, but they're in the TOGs. So we will guide you thoroughly through our mini schedule and through our live sessions. All of this will be uploaded and given to you soon. These are just, some kind of examples that we are showing. From where we can do biostatistics, that is extremely important. So we have our biostat class with Dr. Desiree. Dr. Desiree is a wonderful teacher. She will be giving you all the material. I mean, her class notes is all that you need to seal your confidence on biostatistics. And she'll be giving you questions as well in the class. She'll be discussing questions. And that is all that you need to follow for biostats. Okay. Yeah, so if you have been with her in part 1 journey, you would know. Okay. No, we would not suggest any books or guidelines as of now. You can ask Dr. Desiree if she wants you to follow anything in particular like that. But mostly, see, in biostats, you may get easy questions, which are solvable, easy for all, that you can, just conquer by going through her lecture. If there is a very difficult concept in biostatistics that is being introduced for the first time in RCOG, that is going to be difficult for all. Now, in order to chase around that, I'll have to get all the 6 biostats question right and reading pages and pages of literature and becoming a statistician and leaving out the GTGs is not studying smart. Okay, you have to understand what is the weightage of each segment, right? So in order to get that one concept correct, I am now becoming a full-time statistician. And so going on, preparing on statistics would not be a smart approach to exam. You have to, go through the important stuff first. And then if you have time later, then you can go around chasing whatever statistics books you want to follow. But my suggestion would be follow her lecture. If it's not a very arbitrary concept that is coming for the first time in the exam, you will be able to solve the question from whatever she has taught you. Okay? Take my word for it. So once again, we come back to the topic of being consistent is the key to success. So you have to stick to the schedule, the mini schedule, no matter what. And over here at this point, I would like to introduce Fatima, our coordinator in the course, to take you through the learning management system or the LMS system so that you have some understanding as to how this system is functioning. Okay? So Fatima, do I have you with us?
Thank you very much, Dr. Manjir. Let me just share the screen so that we can quickly take an overview.
Absolutely. Sure.
So my screen is visible to all of you?
No, actually, I'm screen sharing. Just let me stop share. Yes. Now, Fatima, yeah. I believe she's
Alright.
visible to all of you. Just respond in the chat box, guys. Screen visible. Yeah, we get a heads up, Fatima. You can continue.
All right, so welcome everyone. I will be the one to walk you through the key resources available for your support on the LMS that we have. And these resources are very carefully designed for your MRCOG-2 journey. So this is the dashboard overview. Right after you log in your account, you will see this dashboard, okay? On here, you can quickly access your class schedule, upcoming live session, progress tracker for each module, announcement, and important updates. Because we are at a very initial stage, we do not have any class schedules till now. But soon, as we begin with the course, we shall have everything here. So this would be a dashboard. Now what you have to do, you have to click My Courses. Basically, here you will see all your active courses. All the courses that you have joined from MedExam would be available here. So let's take an overview of the regular course here. Okay, so basically this is the overall overview of the regular course. You can see here the lessons. Lessons are basically the content that is recorded and provided to you on the LMS. Next, we have class records. Basically, all the live sessions that we have throughout the course will be recorded here for your assistance. And live sessions are basically recorded so that you can access them anytime, and they're great for revision and catching up on any missed things. All the announcements regarding the course will be updated here. So let's have an overview regarding the recorded content that we have on the LMS. So these are basically the curriculums that we have provided to the course students. We have MRCOG talks summaries, GTT summaries, and NICE summaries. So basically all the year-wise summaries we have comprised here for your assistance so that you can study in a meaningful way. Summaries starting from 2012 are updated here. And we keep making the changes in these.
Okay, so just one point I would like to add here, that when you're
Yes,
going
ma'am.
to the TOGs, I told you that you look for the last 3-year TOGs. So you start from 2025 and go backwards up to 2022. Then you would ask, ma'am, how am I going to find which is the most important, the important TOGs list that you mentioned? Okay, so there was asthma in pregnancy. What you're going to do, make a quick Google check. Asthma in pregnancy, say for example, it was 2013 TOG. Okay, so you scroll further down and you see in 2013 which volume it has come, and you'll find the summary there. So it's very systematic and organized. Are you following, all of you?
Yes, ma'am.
Right. So over to you, Fatima. Yeah, take them through.
Right, let's continue. So these are basically the GTD summaries, and we have kept them up to date in an organized way for all of you so you can study. You can see all the summaries are here. Next, we have flashcards. So it's taking some time. I think there's some internet issue at my end. Let it load. The flashcards are here. Basically, they are for quick revision, and they're designed to reinforce high yield facts. So they can be accessed from here also. So they will be in PDF form, and you just need to click it and they will be visible here, right here. Right now it's taking time, but all the core students will find here. Also, we have customer support team available for your assistance throughout, so you can contact the number anytime. We will just share the number in the chat box also. Apart from the courses, we have events, like all the webinars and everything you have registered for will be available here. The announcements, as I've previously told you, all the announcement that if you have like any rescheduling of the class or any additional class that you have, so that will also be displayed here. This is basically the calendar. So as Dr. Manjir has explained, the live session schedule, and we are going to have about 22 live sessions. So all the live sessions on the designated time will be available to you. So it's so easy to use. You will know, let's say on 10th of July, you have 3 sessions or 1 session. So you will see all the records here once they are scheduled. For most, the important thing is your Q banks. Let me just give you overview of the Q banks also. So basically, when you click the Q bank, you will be redirected towards this page. It will show all the question banks that are available, specifically Talks Q bank, GTG's Nice Q bank, and all the module-wise Q banks. So basically, they are also a part of your course, and you will have these once you enroll in the course.
Okay, so over here, just to cut in between, suppose you have done the sub-fertility module, you go in and solve all the questions module-wise from there, okay? These are our own question banks, combining the important questions from the books, from whatever has come in the exam. The books that you all are referring to, the practice books, they will be provided in the Telegram group, okay? And they are not that updated, but this material is updated. So we would suggest that once a module is done, first try and solve the question bank here, and then you can go back and solve questions from the Telegram group practice books, what you have, okay? From where I can get the date-wise topic schedule, it will be all provided to you as soon as, you know, the course starts. So yes, Fatima, you can take over.
All right, so this is the complete overview. Of course, there are some components yet missing because the course haven't started yet. But as soon as the course will start, we will guide you thoroughly. So this is all about the LMS tour.
Okay. So thank you so much for giving us a wonderful tour of the wonderful system that we have, learning management system of our.
Ma'am, can you also please guide through the phone app that is available on the phone, because it's different from the one that's on the desktop.
Okay, Fatima, can you take that question? The phone app, how different it is from the desktop app?
Yes. Yes, definitely. We have this application and most of the components are same, but obviously the interface of application as compared to a web, it's bit different, but definitely we'll guide you through this. Let me share the customer support number so that we can guide you personally on this.
Okay, so there is a customer support system available 24/7, irrespective of which which time zone you're coming from, so that whenever you're studying, if you're stuck with something, you can pop in a question and they will take it up from there. Okay, so right. So so about being consistent as the key to success. Yes, this is our motto for the day. Now, so this is July, maybe up to October. Okay, you have been consistent and you've consistently practiced. You've tried to imbibe as much as information as you can. You've tried to cover all of that syllabus. But exam is on 15 January, okay? And November onwards. We would want you to really focus on your exam, right? So up till October, November, yes, family commitments, I would say a yes to them. Work commitment, a yes to them. You're just taking along your course and everything fine. But from November, I want you to be focused, okay, for your January exam. Okay, so from November onwards, I want you to be, your focus has to be of something like this. This is a magnifying glass. You know what it does, apart from magnifying objects, if you have done this physics experiment, you'll know that it will be converging all of the sun rays into a focused point, and that leads to burning up of the paper, right? So this is the month of November, and this sun rays is basically your mind, which is scattered all over. It is scattered over your family situations, scattered over your work commitments, scattered over, the breaking news, whatever it is. You have too many distractions. Okay. So November onwards, I want this effect. I want a focus, and that focus is only going to be MRCOG. So as per your work schedule, I would suggest that you would try to, taper a bit of it into a more manageable situation where you can put in more effort in your revision. At your home, I would want you to have, helping hands so that your work stress is not that much. So all in all, November is the month from where you start your focused approach. The last 2 months before the exam, we also have several other courses coming up. From 1st November till the last day of December, we take up a progressive course where we go question solving on all the modules and delivering all of the modules, in a very concise way. It's sort of like a crash course. Okay, so that's your progressive course. We have an exam-like question workshop, what you would like to call, what my students like to call a recall workshop. Okay, that will be taken somewhere just before the exam, right? EMQ workshop. EMQ workshop is also going to be taken by Dr. Hassan to train you more on how to go about solving the EMQs, and that will also be just before the exam. So your EMQs, questions related to that, all of that will be there in your Telegram groups and the practice books, and there will also be a separate workshop on the same. But you have to understand one thing, concepts remain the same. Whether it's an EMQ, whether it's an SPA, the concept remains the same. So at first, I would want you to start with building your concepts on that. So enough said about how to prepare for the exam. Now, the most important step of the exam is to apply for the exam. Okay. So first and foremost step is to create your RCOG account, which I believe, of course, you have because you've already cleared your part 1 or you've appeared for your part 1 awaiting your results. So you log into your RCOG online account and you submit the expression of interest by 9th September. Okay. So by 9th September, you submit the expression of interest. What does it mean? You have submitted to RCOG that you want to appear for January MRCOG, okay, part 2. Why they do it? Because they want to have a survey. They want to have an idea as to how many candidates from whichever subcontinent are going to appear this time in the exam so that they can place their centers that way. Okay. So this has to be done. This is your first step. We will also be alerting you. That is the that is the plus point of, getting into a course, that we will be alerting you as 9th of September comes. That this is the time when the expression of interest has to be there. And if you are already gone through RCOG part 1, a mail we will also be finding in your mail account regarding whether you want to submit your expression of interest. Okay. Now, you will also receive a notification on your mail from RCOG on 21st October as to when booking is opening. So 9th September is the last date for expression of interest. Okay. 21st October is the first day when the booking opens, right? And let me tell you something. At a point of time, just after COVID, booking the exam was probably more challenging than giving the exam itself. Because, there were too many candidates who were waiting for the exam and centers were few, and RCOG is working relentlessly to provide you with more and more centers. But my suggestion is 21st October, okay? A few days ahead of 21st October, maybe around 18th, 19th, you will be getting a mail from RCOG, which will provide you a link, and they will also state that this link will go live on 21st October. Okay. So if you hit the link on 19th October, it won't open. But if you hit the link 21st October at the particular time they had mentioned, that is the time when it is opening worldwide. Now, scenarios vary from year to year. But what I tell my students, because I have seen many people struggling in this situation, is that 21st October, say for example, 2 p.m. GMT, the link is opening. And one candidate is at hospital doing duties. And they thought, okay, maybe after seeing this patient or maybe after the surgery, I'll be logging in. And when they logged in, they found that all the seats were gone. Now the seats are, remaining, but they are not in your hometown. You have to maybe travel to some other city, some other country. And of course, trust me on this, making those last moment arrangements are difficult, and you have to avoid travel as far as possible. If you do have a center in your town, and you just miss out by not being proactive with your booking, is the biggest blunder that you can make. So 21st October, no matter where you are, whenever the booking token is opening, that is one particular day, take it from me, where please be at a position where you can access good quality internet, and please log in through your laptop or your desktop, not through your mobile, because at times there is so much congestion. I have had students who have been crying to me that, ma'am, I tried to log in through my mobile and it went on rotating and the circle was moving, and by the time it opened, all the seats were gone in my city. So I don't want that to be happening to you all. So 21st October, as soon as the link is opening, the time they have stated, and that link will be provided to you 2 days before. I have had students also who thought that 21st October, that particular time, a mail will come. The mail has been sent a couple of days back. Okay. So they were waiting for the mail never came. Then they opened the Telegram group, then they put in the queries that to their friends and buddies, what is up, I am not finding any mail. And then they realized, okay, it was the same mail that has been sent 2 days back. I had to click the link on that. So please be very clear, don't make a blunder on 21st October with your booking, because if you're booking in your city, your last moment revision is easier. If you have to travel last moment, it will become a headache for all. So book your place as app as soon as possible. I cannot stress enough on this point, because I have seen people really struggle with that. Okay. And you have to be ready with an international credit card. A debit card might also work. You have to check whatever they're specifying in the mail, but it has to be international, and you have to pay the exam fee online. Okay, so before this date, have this banking options sorted, right? And have your internet connection sorted, have your work schedule sorted so that you're in front of a desktop or a laptop with a good internet connection with a payment mode that is functional internationally. Okay, is it clear to you all as to how to apply? Now, what about the centers? Well, there are centers all over the world, and they are mostly the Pearson VUE centers. There are 440 centers available in more than 50 countries. You can just scan this QR code. It will take you directly to the portal where they're providing you with the list of centers that they have. So again, this particular line, book early, seats fill fast, first come, first serve basis. Okay, so 21st October is the D-Day when you want to book, right? Certain tips and reminders. You have to keep an eye out on your RCOG portal and email for booking links. See, that is why we have this Telegram community. Once your friend, your study partner, your study buddy, somebody in the group has gotten their mail, there will be some student or the other who will be posting that I got my mail, please check your mail. And that is how you build a community. Okay, you won't feel alone that you're preparing and you're into this alone. You're there, all of you are there. I am seeing that there are around 80 candidates today logged in. Okay, so all of you are there together. Okay, again, another reminder that seats may fill quickly. Okay, so check your country's fee band. Mostly if you're from band B, it is 572 pounds. Of course, in India, you have to pay an additional tax. If there are Indian candidates, please take a note of that. And have a valid ID for the test day. It has to be, it can be your passport, it can be any other ID card of your nation that, that provides your residential details and a clear photograph of yours. That would be enough. That is for the test day. And of course, you have to plan your travel if you're booking outside. Okay? Right. So, now, these are some of the reviews posted by many candidates who have taken the previous session, that is from July 2025 batch, who have appeared for the exam and their thoughts on our course. So with this, I'm just opening the question answer situation for you all. If you have questions, feel free to ask me, unmute, write in the chat box.
Ma'am, actually, I have one request. Before
Yeah.
when any lecture that you're delivering or whatever webinar is going on, is it possible that we could be informed beforehand about whatever material is being used, like the guidelines and the talk articles, so that we could come prepared for the lecture and have a better understanding of the topic?
See, yeah, we will try to make it that way so that you can come prepared, because that is why we start with the modules that way. But of course, there can be one or two talks which the mentor chooses to, introduce in the class itself, just to add the element of interest. Because if everything is, given out first, then what happens? Many of you feel like, I don't want to attend the live lecture because I have, gone through most of it on my own and I know these things. But when you solve questions, you'll understand that whatever you're reading and how you're applying, the entire situation, the understanding varies a lot. So I would always request you, you do have the class recordings, but please be there for the live sessions. That is why maybe not always, most of the time we do share, because that is the major, guidelines that are there. But before the session, before the module starts, we have a mini schedule before that, which kind of covers the most important part of it. And mostly it is common with what we discuss in the live lesson.
Okay, ma'am. Thank you.
When can I get MRCOG certificate? The ultimate Royal College certification happens after you have passed part 3. Okay, and that is a grand convocation ceremony, and that's a lifetime experience. Kindly, you'd like to know how long the recordings will last till the day of your exam. Okay, The portal will be open for access for everything till the day of your exam. Okay, so how many classes do I take? I will be taking for your regular course, I'll be taking maternal medicine. I'll be taking clinical governance and teaching. And I'll also be taking early pregnancy module. I'll be taking your recall workshop. That is the important exam question workshop. Okay, so can we appear in part 2 without training experience? Okay, so see, you have a situation called assessment of training, okay, AOT, that needs to be filled. So you have to look into the email. Have you appeared for your part 1? Your results have come, or you're still waiting for your results? Waiting for the result. You can start preparing at least with the course, but you just have to check with the, I just need to check on that. Can you drop in a message to me, which country you are from, what basic degree that you're having, and I can clear that out for you. You can connect to one of your course coordinators who will be sending over your message to me, and we will be having a look whether you can be eligible. Okay. So any more questions do we have? So the most important, another candidate was asking, there is a special gift for all of you. That is a special discount that we are having. That is for this particular webinar. If you are scanning through this, do we need to study the whole guideline or just summaries? My suggestion to you would be download the guideline or get a printout of the guideline, go through the guideline, the recommendation, the bold part once, and then look at the summaries just for a quick overview. No, classes, Nazia, are not going to start from November. That is the progressive course which is going to start from November. That is the crash course. The regular course is going to start from August. Don't get your basics jumbled. Your regular course is beginning soon, beginning next month. Okay? And even before the live session starts, your mini schedule is going to start right from, sometime around the end of July. And you'll first start with the mini schedule. There will be some pre-course activities with Dr. Rupam, which I'm sure you're all going to enjoy and love how she conducts the activities. So yeah, the coupon discount that we are providing is for the regular course, because 6 months ahead, we are only going to talk about the regular course, and we are also going to encourage you to be a part of the regular course, because in crash course, we're going to be taking things very, fast. Mostly, I would advise crash course for candidates who have appeared in the exam, maybe last session, and they have all of the material ready at their hand. Okay, but somehow they didn't make it. Maybe this time they want to just put an effort in those last 2 months. The crash course is for them. At this point, when you're confused at the level of what material to read, what all to, cover, start with the regular course, because you'll have ample time to take it slow and imbibe all of this. Part 2 is the most difficult part of all the parts, and part 2 is not going to be easy if you try to cover it in the last 2 months.
Excuse me, ma'am.
Yeah, tell me.
Ma'am, as you said that Telegram group is here for us, because there is only permission to write the admin. Still, there is not allowed to write
No,
the
that is not open. That is not open. The course is not open yet. So
Yes.
once the course is open, you all are going to write down daily in the group. Don't worry.
Thank you, ma'am.
That
And
waiting for that.
ma'am, when there is some schedule like there is talk like intracranial hypertension or headache in pregnancy, when we have to discuss this a day before, the talk article will be shared in the group.
Yes, the talk article will be shared on the day, on that particular day, or Dr. Rupa may share, all the materials for that week together. Maybe on Monday, all the materials are coming together, or maybe one talk a day is coming. Okay, so that you can directly ask in the Telegram group if you need any of the materials, and we will be providing you on that. So it will be provided you on the day or beforehand, so that you can cover that on the particular day allocated to you.
Right, ma'am. Thank you. So nice of you.
So are we clear on this? Any
Yes.
more questions for me? When and where can I find the mock exams? You can find them on the LMS portal. Okay, I know just this quick tour of LMS portal may not have cleared all your doubts, but don't worry. There will be a small tutorial video as well on the LMS portal. And whenever you face a difficulty, our helpline people are there to guide you as to how to access the LMS portal. So don't be afraid to ask questions. Don't be afraid to ask for help if you're not being able to find one particular material somewhere. We're always there. The team, we have an excellent team of coordinators who are working day and night so that life is easy for you all. Okay, this discount is when? Well, this discount is open now. Fatima, are you there? Fatima, can you tell us, or anybody from the coordinators, can you tell us for how long is this code open? Yeah, Sabah is responding in the chat box. Customer support number is always available to help you. And she has also provided the number here. Yeah.
Yes, the coupon is available from today till the start of the course, and we will contact the students who are interested to join the course. So
Okay,
students,
so I
please
think
drop a message in chat box who are willing to join our course.
और तुम्हें पता है मैंने पाकिस्तान सरगोदा की ऐसी मॉम कभी नहीं देखी कि इस
Okay, I need somebody from the coordinators to answer the questions on the chat box right now about the payment modalities, installments, and about how long this coupon is going to stay available. Yes, Sabah, please help them out.
Hello, Sama. Can you please tell the students?
With that, I think we are good to wrap today's course.
The hypertension is there, and what will be the choice of antihypertensive? So number one is labetalol.
Okay. So yeah, is the regular course the best among all? See, it takes things at a slower pace than the crash course, and it has all of like majority of the material. So yes, it would be better to enroll for a regular course and take things in a consistent and slow way than to sprint through your progressive course. If you have taken the exam before, Nazia, then you may think about progressive course. Have you taken the exam before? No. So then don't worry. Of course, we are praying part one results will be good, but of course, you better enroll for the regular course because it will be more helpful to you that way. Yeah, crash course would be a separate payment and a separate course altogether. Okay, so with that, it's a wrap on today's discussion. Hope it made things clear for you all. Okay. So bye for now. Hope to see you all in the course soon. And all the best for your part one results.